My name is Diane Worth, and I'm a member of the faculty of the Harvard T.H. Chan School of Public Health and chair of the WHO Malaria Policy Advisory Group. It is my pleasure to welcome you to this two-day virtual webinar on rethinking malaria in the context of COVID-19, with a focus on malaria governance, integrated service delivery, and training and capacity building for malaria. Given the number of participants joining us today, I think at last count, 772, with more than half joining us from Africa. We are presenting live via Zoom and recording the proceedings so others may join in this global discussion. Together with the fellow faculty members of the Harvard T.H. Chan School of Public Health, I would also like to recognize our university co-sponsors, the Harvard University Takimi Program for International Health, Defeating Malaria from the Genes to the Globe, the Center for African Studies, and the David Rockefeller Center for Latin American Studies for helping us expand the reach of this webinar. I would like to also acknowledge our co-sponsors and partner institutions, the vast majority of which are academic and research institutions located in the Global South, for their contributions and input throughout this engagement, including Makerere University in Uganda, Ifakara Health Institute, the Multilateral Initiative on Malaria, Africa CDC, Kemri Wellcome Trust in Kenya, IAVI, and Health Strategy and Delivery Foundation. There are many more featured on our webpage. So why are we here today? The urgency of the global pandemic has highlighted the need for the malaria community to rethink its strategy and critically look at the ways we've been doing things. There is an increasing recognition over the past years that we are not on track to achieve the ambitious goals of the global technical strategy for malaria. Progress has stalled, and to greatly reduce malaria burden and elimination, we need a course correction. I'm sure you'll all agree that over the past decades, malaria has functioned as a single disease program, and there have been many successes. But today there are 220 million cases and 435,000 deaths worldwide. This is the same level of human suffering as was the case in 2015, and Africa suffers 90% of this malaria burden. What you're going to hear today is a culmination of a nearly year-long effort, which began as a discussion between Pedro Alonso, who's the director of the WHO Global Malaria Program, who is with us today, Michael Reich, Rose Lakey, who is chair of the advisory committee, and Alistair Robb and myself, and has evolved into a global conversation. I'm now going to turn over to Dr. Speciosa Wandira. She's the former vice president of Uganda and current special advisor to the president of Uganda. Speciosa is a graduate of the Harvard Chan School, and she co-chaired the governance working group. So Speciosa, over to you.
Thank you, Diane. I also want to welcome all of you who are here with us to discuss this very important subject. I am a surgeon, an MD, and a global health and population expert. Why are we here? Basically, it's because COVID-19 has given us the opportunity to rethink our strategy in the way we are looking and handling malaria. All of us have seen how COVID-19 has laid bare the limitations and inequities of our global health systems, in particular, challenges related to governance, service delivery, integration, and the health workforce. COVID-19 has also brought about the fastest vaccine and diagnostics in history, proving our ability to quickly bring new, powerfully effective treatments to bear on public health challenges. And this is exactly what is needed to end malaria. Lessons from COVID-19 will help us rethink malaria. Look at the assumptions we make, look at the approaches we use and whom we work with, and then decide on the best solution for the situation. This brings me to the issue of how we have been organizing the Rethinking Malaria initiative. This process was fundamentally rooted in listening and learning from those on the front lines of malaria control, especially those individuals working in Africa, where the majority of the malaria cases and deaths occur. But of course, many of the findings that we will discuss today and tomorrow are relevant for other malaria endemic regions. This global consultation was organized across 3 working groups. The first one dealt with malaria governance. The second looked at integrated service delivery for malaria. And the third group focused on training and capacity building. As you will hear from our speakers later today, there is a lot of interrelatedness of the topics, but each working group set out to offer specific recommendations and will be making them widely available in the coming weeks. On the 1st of September this year, Harvard co-hosted with partner universities a webinar to kick off the discussion. Dr. Moeti, director of the World Health Organization Afro region, provided opening remarks to set the stage. And then we were joined by His Excellency President Museveni of Uganda, who, after everything was said and done, challenged us to clearly demonstrate the savings that will accrue from eliminating malaria. I guess this is what will move politicians and economists. We must commit to continuing this rethinking malaria conversation in our communities, in our homes, with the colleagues working across sectors and disciplines, and with those in leadership positions. All of us must commit. However, we must not rethink and stop there. We must do things better, even do things we have not done before, work with partners we have not worked with before, and use tools we have hitherto ignored. The key to elimination is in actioning what we have rethought. I would like to turn you over to Diane to introduce the first panel. You are all most welcome, and stay tuned, like the media would say.
Thank you very much, Specioso, for those words. I'd like to mention to all of those, the website, Rethinking Malaria, has all the bios for the speakers and panelists. So we'll be doing minimal introductions to allow the most time to be spent on the deep content. And I also would remind everybody that the working papers, the papers from each of the working groups are also posted on the Harvard Dash system, and the link is available on the rethinkingmalaria.org website. With that, I'm going to start with our first panel and turn it over to Ife Anibo to lead that panel on malaria governance. Over to you, Ife. Sorry, Pedro has joined us. I apologize. Pedro, welcome. I'd like to introduce Pedro Alonso, the director of malaria, the Global Malaria Program at WHO, and just ask him to make a couple of comments. Pedro has been involved in many of the discussions, and particularly in listening mode. Pedro.
Well, thank you, Dan, and thank you, Speciosa, dear friends and dear colleagues. My function is, at this point, is, as Speciosa was saying, one of listening, and learning. I want to acknowledge and appreciate the leadership and the work that the Harvard School of Public Health and so many other friends and colleagues around the world, with a special focus on Africa, have been playing in these deliberations. The background and the purpose for this exercise both of you have already laid it out. We have stalled in our progress in the fight against malaria after a golden decade of unprecedented progress. Going on doing the same thing over and over again and expecting a different result does not seem to be the right way to move forward. WHO does not have the answers to everything, or probably to most of the things. And that's why we welcome initiatives like this one that convenes, brings together in an academic environment, but open to very different views and perspectives, brings the malaria and the public health and global health community together to help us understand why are we stalling, what are the barriers to progress, and how can we do better moving forward if we are to realize our joint vision of a malaria-free world. So with that, I hand it back to you. I thank you for the opportunity of being here. And as I said, we are on listening mode, we are on learning mode, so that we can extract the lessons and of these 2 days and see how can we get back on track in our global fight against malaria. Thank you, Diane.